Hello all. Today I'll give you a brief information regarding blood. It is a specialized fluid but contains cells and proteins that make the blood thicker than the water, and it has four components. The first one is plasma, second erythrocytes, third leukocytes, and the last one is platelets. First we'll see about plasma. It's a small straw-colored content and it accounts for 55% of our blood, which carries water, salt, enzymes and other substance also. And it plays an important and key role in transporting the blood cells, nutrients, proteins and hormones. And it is essential for maintaining the good immunity, blood clotting function, blood pressure, blood volume, and it is essential for the balance of pH in the blood. The second one is RBC, red blood cell or erythrocyte. It is a most common type of blood cell which gives red color character to the blood. It is small, round, biconcave in shape. The main function of RBC is carries oxygen from the lungs to the tissues and also carries carbon dioxide from the proximal areas to the lungs. And the lifespan of RBC is 100 to 120 days. The third component is WBC, white blood cell, also known as leukocytes. They are colorless round shaped cells. They are part of our body's immune system and they are help the body to fight against infection. But it accounts for only 1% of blood. They are produced by the bone marrow and it has 5 types. I'll list down 5 types and one line function of each type. First type is neutrophils. It kills the bacteria, fungi and foreign bodies. Second, monocyte. It clean up the damaged cell. Third one is eosinophils. It kills the parasite and involved in allergic response. Fourth one is lymphocyte. It helps in fight against virus. The last one is basophil. It involved in allergic response. The last component of blood is platelet. They look like a tiny colorless plate. When a blood vessel tear, this platelet stick together to form a clot and plug the torn blood vessel to stop the bleeding. For example, if you have a cut injury in your finger, the platelet which is present in the area will stick together and release the chemical signals. So, more platelet will respond to the chemicals. They will build up together through the interlocking mechanism and seal up the torn blood vessel. This is called platelet activation and coagulation cascade. And I want to share in what are all the conditions the platelet level will be decreased and in what are all the conditions the platelet level will be increased. First we see about the decreased conditions. The patient who are all taking antiplatelet drugs, for example heparin, warfarin, the platelet level will be decreased. And the patient, those who are taking chemotherapy and radiation therapy, this drug will inhibit the production of platelet from the bone marrow. Third one is viral infection. This virus will attack the platelet, so platelet count will be decreased. And the last one is pregnancy. In pregnancy, if the mother has HELLP syndrome, the full form of HELLP is hemolysis, elevated liver enzyme and low platelet count. It is a type of preeclampsia which is characterized by increased blood pressure and more breakdown of blood cells. In this condition, the platelet level will be decreased. And I'll tell you in what are all the conditions the platelet level will be increased. The first one is patient with bone marrow disorder. And the second one is patient with chronic inflammatory disease. For example, rheumatoid arthritis, irritable bowel syndrome and Crohn's disease. Third one is iron deficiency anemia. Whenever the body is undergoing breakdown of cell, our bone marrow will increase the production of platelet to meet the needs of the body. And the next one is spleen removal. 1/3 of platelet always stored in our spleen. So when we remove the organ, the platelets will stay in the bloodstream, but it is temporary condition only. And the last one is if the cancer occurred because of infection, for example gastrointestinal cancer, lymphoma, lung cancer, ovarian cancer and in breast cancer. If the cancer is occurred because of infection, the platelet level will be elevated. That's all about the blood and the components of blood. Thank you for watching.